Hi, my name is Tina Patterson, and I am a Medicare coordinator and care manager at Casey Shepherd Center. I'm also pursuing my master's in social work with the University of Oklahoma. And I'm really proud to be a part of Casey Shepherd Center. Their vision I really hold dear to my heart. I'm really passionate about working with older adults, and their vision is all about empowering, celebrating, and serving older adults. I've included our webpage at the bottom left-hand corner if you'd like to take a look at our organization. Medicare 101, that's what we're going to go over today. There's lots of moving parts when it comes to Medicare, just regardless of if an individual has worked in the insurance field or has a bachelor's degree, Medicare can be very overwhelming. And so we're going to go over the basics today. We're going to go over Medicare eligibility and enrollment, original Medicare parts A and B, Medicare supplemental insurance, also known as Medigap, Medicare Advantage plans, which are also known as Part C, and Medicare prescription drug coverage, also referred to as Part D. And also I'd like to point out, we are, when I say we, Casey Shepherd Center is affiliated with the SHIP program for Missouri, and that is the State Health Insurance Assistance Program. And it's designed to help, people living in that state to kind of navigate and gain some resources and education regarding Medicare. And each state has their own SHIP program. I've included the website down below, and you could go there and click on the state and access their SHIP website from that location. What is Medicare? It's a health insurance program for people 65 years or older, or individuals that are under 65 with a disability. They would have to be on SSDI for 24 months before they're eligible. Medicare is administered by the Centers of Medicare and Medicaid Services, CMS. And an individual can enroll in Medicare either through the Social Security Administration or Railroad Retirement Board. There are some enrollment periods. The initial enrollment period, which lasts 7 months, it begins 3 months before the individual's 65th birthday. So an example would be 3 months before their birthday month, and then 3 months after. And then down below, you can kind of see if an individual enrolled in that first month, the coverage would start 2 months after the enrollment. And then, likewise, 3 months after they turn 65, the enrollment or the effective date would start 3 months after enrollment. Basically, they're not automatically enrolled in Social Security, or I'm sorry, Medicare, unless they have been receiving their Social Security or Railroad Retirement benefit. So that's important to note that, automatic if already receiving that benefit. If not, then they would need to apply. The special enrollment period, this is for individuals and their spouses that have continued to work and had employer coverage. And then they decide, they retire, and now they've decided they want Medicare. So basically, this period, the special enrollment period, lasts 8 months. And so it begins when the employer coverage ends, and when you are notified, it will end. And then that 8-month period would start. And then once the individual's Part A and B becomes effective, then they would have 63 days to enroll in a Part D, which is a prescription drug plan. And then some may choose to enroll in a premium-free Part A at age 65 during their initial enrollment period and use a special enrollment period to enroll in Part B when their employer coverage ends. So again, basically, if an individual opted out of having Part B because they were continuing to work or their spouse was continuing to work and they have credible insurance coverage, then basically when the time came that they decided that they wanted to opt in, they would need to fill out an application for Medicare Part B, which is listed down below as the CMS 40B application. And then along with that, they would have to submit the CMS L564, which is requesting the former employer to verify that they had credible coverage during that period of time. And it's important to include that form so that they won't encounter a penalty for not having credible coverage during, that time period that they opted out. The ways to apply for Medicare Part A and B enrollment, like I said, was Social Security Administration and the Railroad Retirement Board, and I have their contact information there. So we're going to discuss Original Medicare and Medicare Advantage Part C. These are the two options for individuals when they come on and enroll in Medicare. So Original Medicare is constructed of Part A, which is inpatient hospital coverage. Part B, outpatient medical coverage, like doctor services. And then they can opt in to enroll in a prescription drug plan. I say opt in, but I never would say not to, and we'll get into that a little bit later because there can be a penalty with that further down the road. And then it's optional for supplemental coverage, either to purchase a Medigap or a supplemental insurance to fill in, the 20% that Medicare doesn't cover, or they might have a supplement through a former employer or union, or they might also be on Medicaid, which is known as dual eligible. And that acts as a supplement where they pay the 20% that Medicare doesn't cover. And when I say that, Medicare only covers 80%. And it's important to note that Medicare supplemental insurance, Medigap policies, only work with Original Medicare. So, the other option here, which is a Medicare Advantage Part C, you would not need a supplemental insurance, a Medigap policy purchased if you chose to go with Part C, which is a Medicare Advantage. Medicare Advantage plans consist of Part A, inpatient hospital coverage, Part B, outpatient medical coverage, and then they do include a prescription drug plan, and they do cover some extra benefits such as dental, vision, and hearing. Oftentimes, they also include a fitness benefit and over-the-counter benefit, which is a allotted amount on a debit card that the individual could use to purchase drug over-the-counter and drugstore items. And then there are some lower out-of-pocket costs on some of the plans. Part A, we're first going to go over that. Part A helps pay for the inpatient hospital coverage, also skilled nursing facility care, home health care, hospice care, and blood, when they refer to that, units of blood or blood transfusions. Part B helps pay for doctor services, outpatient medical and surgical services and supplies, diagnostic tests, outpatient therapy, outpatient mental health services, some preventative health care services, durable medical equipment, some medications that are generally not self-administered in outpatient hospital stays. There is a monthly premium for Part B. Most pay, the baseline is $170.10 a month. However, it can go up from there depending on income. For a single person making $91,000 or more, it could go up. And then for a couple combined income of $182,000 or more, it could go up from that $170.10. And the individual has an option of either having that monthly premium taken out of their benefit check a month automatically, or they might opt in to have it billed either quarterly or monthly, and they mail in that payment. Those are the two options. So again, I like to use a chart here just because there's so many parts and it can get kind of confusing with all the letters. So we just discussed with original Medicare Part A and Part B, and now we're going to go into the supplement, Medigap. Medigap, Medicare supplement and insurance, also known as Medigaps, work with Medicare Parts A and B. They are designed to cover Medicare A and B out-of-pocket costs like deductibles, co-pays, and co-insurance. Medigaps do not cover services that are not covered by Medicare, like dental work or routine hearing exams. If Medicare denies a claim as unnecessary, a Medigap will not cover it either. So again, these work along with Medicare. They're not like additional coverage or anything like that. It's, well, I'll take that back. It's not that it's not additional coverage. It's just not anything new. It's basically the reason why it's called a Medigap is because Medicare covers 80%, and then Medigap policies fill in the gap where Medicare doesn't. They pay that 20%, and that's the way I remember it. So it's an additional coverage to cover the costs, but there's not additional benefits from having a Medigap. It's just additional coverage to help pay with those costs and fees. All Medigaps are accepted by any provider who accepts Medicare any place in the United States. So with original Medicare versus going with a Part C, I always point out one of the differences is that Medicare, original Medicare, basically, like this says, you can go any place in the United States that accepts Medicare, which is really nice. And with having a Medigap, even though it's purchased through a private insurance company, they still work the same way, which is really nice. And then Medigaps are standardized by the government, assigned letter names to make it even a little bit more challenging. So yeah, they have those labeled Plan A, Plan B, Plan C. I believe it goes all the way to M or N. And they are sold by private insurance companies. And you enroll directly with the company offering the plan you want. But I also point out when I'm working with clients that once they've selected the Medigap plan, you know, they're labeled by letters. So say they choose Plan G. Despite what insurance company they go with, they're going to get the same coverage. So the main difference, or what they're going to focus should be on, is what the premium amount that they're going to get charged. And each insurance company charges a different premium based on their own criteria or formulary that they use to calculate that. And so I always tell people it's really important to kind of shop around with those. I've even referred people to go see a broker, just because, you know, you really want to get the best one for the money. You know, you want to get the lowest premium, and there's several to choose from. So that kind of helps narrow it down, and a broker, you know, can sometimes have a little bit more insight on which one might be the best, you know, for your needs. Medicare choices again. So again, I just like to refer back to this. We've gone over Part A, Part B, and then the Medigap. Now we're going to go over Part D, prescription drug plans. Part D, Medicare prescription drug coverage. Medicare Part D plans help pay for outpatient prescription medications, typically dispensed by a retail pharmacy, either a bricks and mortar store or mail order. They're sold by private insurance companies that contract with Medicare. Plans are known as Medicare prescription drug plans, PDPs. So we as Medicare counselors, we refer to these as PDPs, and this really is the bread and butter of open enrollment, which is a great time to review these plans. I would say it's vital to, just because they change the premiums every year on these prescription drug plans. So it's really important to review those. And anyone with a Part A and or Part B who lives in a Part D service area is eligible for Medicare Part D coverage. Part D eligibility and enrollment. Enrollment is not automatic, and it's really important to note that it's not. A lot of people sometimes assume that it is. And again, it's not required for an individual to enroll in a prescription drug plan. But again, if they miss that 63-day window of enrolling, or the eighth month window for a special enrollment period, then they will encounter a penalty. So it's really important to note that you need to be mindful of those time frames of enrolling, and that it's not automatic. It's also important to select the plan that best meets your medication and financial needs. So again, there's so many choices. And so with my clients, what I do is I go into Medicare.gov and I use that Medicare plan finder to really kind of plug in their prescriptions, their preferred pharmacies, and Medicare.gov does the work for us. It will populate the best plan. Either we can sort by lowest premium or lowest deductible, and it will pull those plans that fit well with all of that. Each plan has its own formulary, the list of drugs that the plan covers, and some plans have preferred pharmacies where the cost will likely be lowered. So again, the preferred pharmacies, that's why it's important to put in the pharmacies. I might get somebody in that prefers to go to CVS, but then once we plug in their prescriptions and we choose 5 different pharmacies and we kind of get in and see what's available, that might change because it might be way cheaper for them to go to Walmart on a certain plan that covers all their prescriptions versus a plan that has a preferred pharmacy of CVS, but it doesn't cover all their prescriptions. So it's really a great tool to use. And I encourage, the beneficiaries or clients that come in to see me to utilize it. Part D enrollment period. So the initial enrollment period for prescription Part D, Part D is the same as original Medicare. So you'd have that 7-month window. And then for the special enrollment period, it would be 63 days from the qualifying event. So either retirement causing loss of credible coverage from an employer plan, involuntary loss of credible coverage, moving out of current plan's coverage area, moving out of a nursing home, leaving a Medicare Advantage plan within the first 12 months of being enrolled, in a Medicare Advantage plan for the first time, returning to the U.S. after living abroad, release from incarceration, or Centers of Medicare and Medicaid Services also can grant special enrollment periods for emergency circumstances. Prescription drug costs. So costs vary by plan. There's many to choose from. And I know, you know, the national average is $33.37. And then the annual deductible is no more than $480. Co-payments and co-insurance may apply. So basically, out of all of the plans, the average is that $33.37. I've seen them as low as $6.80 for 2022. And I've seen them as high as over 100 with no deductible. And people often ask me, you know, why is one so much more than the other? Is it better coverage? And the answer is no. Once you put in your prescriptions, the plan that's $100 with no deductible, your prescription drug costs could be thousands more than the plan that costs $6.80. And honestly, I look at it as a chess game with these prescription drug plans. They change them every year. And so that's why it's so important for people to review those during the annual open enrollment, which is October 15th through December 7th every year. And that's the best time to review those and make any changes because you can switch your plans at that time. And you know, to give an example, this year, SilverScript, SmartRx, they're the ones that are $6.80 premium this year. However, next year it might be Humana Gold or, you know, Clear Springs. That might be $6.80, and then SilverScript, SmartRx might be the one that's $57. So there's no rhyme and reason to it. And so it's really important, like I said, to review those and pass the word along to your clients that it is. It's really important to review. Part D, late enrollment penalty. Enrollment in a Part D plan is not required. That was what we saw early on. However, if you do not enroll in a Part D plan when you are first eligible, and you do not have other credible coverage, your premium will be higher if you enroll in the plan at a later date. A late enrollment penalty will be added to your monthly premium each month for as long as you have Medicare prescription drug plan. So, and it can add up. The longer amount of time, the higher the penalty will be. Basically, it's calculated by the number of months that you did not have prescription drug coverage. The penalty is 1% for each month, and they times that times the national benchmark monthly premium for that year. So this year it would be $37.37. And if you qualify for extra help, which is great news, then your late enrollment penalty is eliminated. And so extra help is a Medicare savings program. It is based off of income, and it's something that can be applied for after you're on Medicare. You actually have to already be in and on Medicare to apply for it, and it would be applied for through the Social Security Administration. And again, it's based off of income. And again, if you qualify for that, it would eliminate any late enrollment penalty, which is great. And then it's important to note too that if an individual had VA coverage, that is credible and it covers medications. And so they are not required to be in a prescription drug plan if they are also receiving VA benefits or coverage. Okay, so we got through original Medicare, and we talked about Part A, Part B, the supplemental Medigaps, and Part D. And so on the other side of the fence, we're going to take a look at the other option individuals have when they're eligible for Medicare. And again, you see here that it includes Part A, Part B, and Part D of what we've already went through. And that all equals what we're about to talk about, which is the Part C, these Medicare Advantage plans. So Medicare Advantage plans are not supplements or Medigaps. They are alternative to original Medicare Part A and Part B. They are, private health insurance plans that are contracted with Medicare. They include all benefits and services covered under Part A and Part B, which is good. you're getting the same services, may charge an additional monthly premium. So there are some that have a premium, but more often than not, the premium is zero on these Medicare Advantage plans. The plan determines the cost of services for its members, from co-pays, co-insurance, for services provided. And then the plan determines providers in their network, and this may be geographically limited. So basically, what I always tell people when we're going over the fundamentals here of Medicare is that original Medicare, again, you can go anywhere in the United States if you know that accepts Medicare. But with a Medicare Advantage plan, that does restrict your network, and it can. And that would mean that it would probably be, you know, in a location of the state that you're living and residing in. But I have noticed that a lot of these Medicare Advantage plans have started adding this national network benefit. And basically, if it's listed on that plan as a national network benefit, I've double checked it, and basically that means that they could go anywhere in the United States. They would have to plug in where they're at, where they're visiting, like the zip code, into the plan finder on the website for their insurance, you know, company that they're enrolled in this Medicare Advantage plan. And then the providers would come up, and then there would be no additional charge to that. So that's really, really a great feature that's just newly been available, I think, since 2021. And then usually they include a Medicare prescription drug coverage plan. Again, most of them all include a prescription drug plan. The only ones that I have not seen are the ones that are for and designed for individuals that are also receiving VA benefits or have VA coverage. They may include extra benefits and services. So a lot of times, all of these Medicare Advantage plans offer things like dental, vision, and hearing coverage. They'll also include a fitness benefit, and oftentimes they have an over-the-counter benefit as well, which is a allowance that is put on a debit or credit card for the individual to purchase drugstore over-the-counter items, which is really nice. Medicare Advantage enrollment period. So Medicare Advantage open enrollment is every year, January 1st through January 1st through March 31st. And basically they would have to be enrolled in a Medicare Advantage plan as of January 1st. So the prior year during, you know, October 15th to December 7th, they enrolled in a Medicare Advantage plan. So by, you know, January 1st, that's when it takes effect. So they'd have to be enrolled in one at that time. They could either make a switch to another Medicare Advantage plan during that 3-month window, or they can switch back to original Medicare and pick up a prescription drug plan at that time. And a supplemental. But it's also important to note that any change will be effective the first day of the following month. So if they make that change in February, it would be March 1st. So cautions when choosing a Medicare Advantage plan. Before you enroll, you want to verify that your doctors and preferred hospitals and things like that are all covered by that plan. And then you also want to review your drug coverage and costs and make sure your prescriptions are covered. And then understand the cost share for services you will receive. So these plans don't have a premium. However, there are some, you know, percentages of cost share for services. So you definitely want to take a look at that formulary and the benefit, you know, what's all covered, to really understand what cost and what the services are that you will receive while enrolled in that plan. And then also clarify specifics around the extra benefits. So, you know, a lot of times when people hear that they include dental, vision, and hearing, that that's 100% coverage. That's not the case with these extra benefits. Basically, there's limited amounts that they offer. So there might be a certain dollar amount, or you know, you might not be able to go every year. It might be every other year. So it's just really important to take a look at that and be aware before choosing one. They're all different. They all have slight differences. And again, Medicare.gov, great tool, great resource, and you can view status, including Part D claim, excluding, I'm sorry, Part D claims. So you can view a claim except for any, you know, that are Part D. Order a duplicate Medicare summary notice, which is also referred to as an MSN or replacement Medicare card. View eligibility and entitlement and preventative service info. View and modify your drug list and pharmacy information. And view address of record with Medicare and Part B deductible status. And access online forms, publications, messages sent to you from the Center of Medicare and Medicaid Services, CMS. Save the dates. So we've already passed January 1st to March 31st for this year, which would be a great time to take a second look at any Medicare Advantage plan, people that are enrolled that might want to switch back to original or switch to a different Medicare Advantage plan. And then, of course, we're going to be coming into October, our annual open enrollment, which is October 15th through December 7th. And again, this is a great time to review those PDP plans, prescription drug plans, and, you know, take a look at, you know, if your prescriptions are still covered and what that premium, if the premium has changed any. And also it's, you know, people can also choose to enroll in a Medicare Advantage plan during that time if they want. And it's important to note that there is no open enrollment periods to purchase supplemental Medigap policies. So that can be done at any time of the year, and it can be dropped at any time as well. I really appreciate you taking the time to listen to this presentation, and I hope it was informative. If there was something that maybe I didn't cover or wasn't clear on, feel free to contact me. I put my contact information below, and thank you. Have a great day.